Good morning. This is a 10-minute trauma station aiming to assessing your trauma skills. As you are assessing the patient, please make sure to verbalize every step of the assessment. You can ask about any additional information, vital signs, blood test, imaging, while assessing and stating the patient as needed. Okay. Before starting, any questions?
No.
Great. Patient is a 34 years old male patient presented to our emergency department in a rollover motor vehicle accident. EMS mentioned that vital signs at presentation are blood pressure 95/60, heart rate 120, respiratory rate 22, and saturation 94 at room air. Okay, capillary glucose level is 95. And Glasgow Coma Scale at presentation is 11 with a responsive patient. Okay, you can start.
Okay, we will start by activating the trauma team. Dr. Hassan, you will be at the airway. Please check the airway and please check the cervical spine. Dr. George, will be at the IV. Please insert 2 large bore IV lines and activate massive transfusion protocol. We will prepare 4 packed RBCs, 4 FFPs, and 1 pool of platelets. Dr. Hassan, please immobilize the cervical spine and call radiology for an urgent chest X-ray and pelvic X-ray.
Okay.
Okay, so we will assess patient responsiveness. Mr. John, can you hear me? Okay, so patient is responsive. We will start the primary survey. Please check if the airway is patent.
Airway is patent. Cervical spine is immobilized.
Okay. There is bilateral chest rising. There is good bilateral air entry. Saturation is 94. Please give supplementary oxygen. Okay. So our patient is hypotensive and tachycardic with weak peripheral pulses. Please give 1 packed RBC.
2 large IV bores are inserted. 1 liter of NSS is infused, and we are preparing to transfuse the first unit of packed RBCs.
Okay. So on physical exam, there is pelvic instability with signs of left hip bleeding. What are the findings of the pelvic X-ray?
Pelvic X-ray showed open book fracture with signs of hip fracture at the left side.
And the chest X-ray?
Chest X-ray is totally normal.
Okay, so we will apply the pelvic oil. So pelvic binder is applied, tachycardia is decreasing and blood pressure is increasing. Please give 1 more packed RBC.
1 packed RBC will be transfused.
Okay. Patient's skin is exposed, there are no bruises, there is no sign of bleeding externally, and there is no sign of chemical burn. So we have concluded the primary survey. We will move on to the secondary survey and do a head-to-toe exam. Please search for any head traumas or lacerations.
No signs of head or neck lacerations or injury.
Please check for pupil reactivity.
Pupils are reactive.
Okay. Chest physical exam and abdominal physical exam are normal, noting slight tenderness at the left hip. Rapid neuro exam appears normal. We will do a log roll to examine the spine.
On my count, 1, 2, 3.
Okay, there is no sign of displaced or fractured vertebra.
On my count, 1, 2, 3. Patient is losing consciousness.
Okay, saturation is decreasing. Glasgow Coma Scale is now 7. Please start ambobagging and prepare for intubation.
One breath is being given every 6 seconds. Patient is intubated. Airway is secured. One breath is being given every 6 seconds.
Airway is secured. There is bilateral air entry. Vital signs are improving. Tenderness is increasing on the left hip. Please start pain management and please prepare the patient to be transferred to a total body CT scan.
So patient presented for a polytrauma and a motor vehicle collision. At presentation, vital signs was patient was hypotensive, tachycardic, and borderline saturation at room air. Primary assessment showed patent airway, C-spine was immobilized, bilateral chest rising with good bilateral air entry, pelvic or abdominal and pelvic exam showed pelvic bruises at the level of the left hip with evidence of pelvic instability and possible injury in the pelvis. Okay, C-spine was immobilized, pelvic binder was applied, and 2-unit packed RBCs was given, showing improvement in the vital signs of the patient. At the secondary survey, a head-to-toe examination was done. There was no evidence of head trauma, no evidence of chest trauma. Abdomen was showing tenderness at the level of pelvis. Rapid neuro exam was pretty normal, and rapid review of the vertebral spine was normal, showing no evidence of vertebral body fracture. While doing the secondary survey, patient has showing a deterioration in level of consciousness, and that increased the need for intubation and definite airway, and to repeat the primary survey as airway, breathing, and circulation. Then after stabilization of the patient, vital signs are stable, and then the patient is ready to transfer to the CT scan. Okay.